Hi, today I'll be presenting the article Prophylactic Swallowing Exercises in Patients with Head and Neck Cancer Undergoing Chemoradiation. Patients with head and neck cancer often struggle with dysphagia after chemoradiation, which is now the most prevalent treatment for head and neck cancers. While chemoradiation preserves the anatomical structures that are often impacted by surgical resection, the toxic effects of chemoradiation can lead to swallowing mechanism dysfunction, acutely and long term. Chemoradiation can lead to progressive onset of fibrosis of the tissues of the oral cavity and laryngopharynx. This stiffening disrupts the ability to transport the bolus for efficient swallowing. Dysphagia and pain resulting from chemoradiation are often resistant to traditional therapy and can lead to malnutrition and weight loss. If severe dysphagia persists, alternate means of nutrition such as PEG tubes may be needed. To improve the quality of life of patients, as well as to reduce medical costs, non-invasive treatments have been investigated. This led to the research question: are there benefits to prehabilitation? This would entail exercises before and during chemoradiation intended to promote strength and range of motion of the swallowing mechanism. Prehabilitation aims to optimize pre-treatment functional capacity for better tolerance of treatment, facilitate recovery, and prevent development of persistent late effects. Using video fluorographic assessment, 3 common physiological changes in swallow function after CRT have been found. Firstly, decreased tongue base retraction has been found to result in reduced propulsion of the bolus into the pharynx. Secondly, reduced laryngeal elevation has been found to result in residue in the vallecula and the piriform sinus after the swallow. Finally, decreased pharyngeal contraction has been shown to result in bolus residue in the pharynx after the swallow, as well as impaired bolus propulsion into the esophagus. Swallowing exercises directed towards these impairments have been proven to improve the mobility and motility of these critical structures after chemoradiation is completed. Because post-chemoradiation swallow exercises are beneficial, researchers at Mount Sinai Hospital have developed this experiment to investigate the impact of prophylactic use of these exercises. Patients assigned to the intervention group were instructed in 5 prophylactic swallowing exercises and participated in weekly swallowing therapy sessions. These swallowing exercises were selected to improve tongue range of motion, tongue base to posterior wall contact, laryngeal elevation, and pharyngeal contraction, all in the hopes of improving bolus transport to the esophagus. Intervention members were encouraged to perform 10 repetitions of the exercise 3 times a day. Weekly face-to-face meetings with an SLP helped determine their compliance and reinforce learning of the proper technique. The control group received no prophylactic care and were referred for swallowing treatment after completion of chemoradiation if indicated. Functional measures of swallowing and quality of life were used rather than instrumental assessments to determine the functionality of prehabilitation. The FOIS is a 7-point scale of oral dietary tolerance. It ranges from 1, which is nothing by mouth, to 7, total oral diet with no restrictions. It provides important information about what types of special preparations or limitations patients must make in their oral diet, as well as the need for nutritional supplementation such as a PEG tube. The PSS H&N was rated on 2 scales: eating in public, which ranges from can eat out anywhere with anybody to always eats alone, and normalcy of diet, which ranges from no dietary restrictions to complete non-oral feeding. As seen in the table, the findings of the FOIS were that prophylactic swallowing exercises lead to statistically significant improved outcomes for intervention patients 3 and 6 months post-chemoradiation. Results of the PSS, H, and N also indicated statistically significant outcomes in the eating in public and normalcy of diet scales for intervention patients 3 and 6 months post-CRT. However, the control group was not statistically significant on either rating 9 and 12 months post-CRT. It was not statistically different on either rating 9 and 12 months post-CRT. Sorry about that. In conclusion, patients in the intervention group had improved functional swallowing and quality of life outcomes at 3 and 6 months post-CRT, though patients in the control group were not significantly different 9 and 12 months post-chemoradiation. There were no significant differences between groups in PEG tube placement, though this may be due to acute sequelae of CRT, such as mucositis or sores in the mouth and esophagus, and odynophagia, or painful swallowing. These results lead to other questions, such as, what is the mechanism of prehabilitation's impact? A recent study of the effect of exercise on wound healing and inflammation reduction suggests that exercise may work to decrease some of the factors implicated in post-radiation fibrosis. Exercise of the swallowing mechanism and structures might also help to strengthen the non-fibrotic tissue to compensate for the lack of mobility of fibrotic structures post-chemoradiation. Another question is, did the control group catch up to the intervention group through post-chemoradiation rehabilitation? Further research will hopefully provide answers to these questions. Prehabilitation is the standard of care in many cancer centers in the United States. Once a medical oncologist diagnoses the head and neck cancer and prescribes chemoradiation, the patient is oftentimes referred to the SLP before chemoradiation starts. If they follow this protocol, the patient should be given the written instructions for the swallowing exercises and have weekly follow-ups with the SLP during chemoradiation. These exercises are already proven to help, and evidence for prehabilitation is beginning to mount. There are limitations of this study. Small sample size may have limited the ability to detect significant differences, both between groups and between times that each group was tested. As well, 69% of patients, or 9 of 13, that were assigned to the intervention were unable to perform the swallowing exercises beyond week 5 of CRT. As reported by the participants, this was due to the considerable pain and fatigue caused by the chemoradiation and was not an adverse effect of the exercises. Now let's move on to the maneuvers. First, we have the effort-filled swallow, which increases tongue-based retraction and pharyngeal pressure to improve bolus clearance from the vallecula. And luckily I have some water and I can just demonstrate it. It involves constricting everything around here. Squeeze all your muscles. That was great exercise. All right, and then next we have the tongue-based retraction and tongue hold maneuvers, which improve tongue-based posterior pharyngeal wall contact to improve pharyngeal propulsion of the bolus. And this includes the tongue hold, which is where you squeeze your tongue between your 2 front teeth and swallow. I'm going to demonstrate it with my spit. As well as the tongue retraction, which is where you pull the back of your tongue to the back of your mouth and hold. I wish I could show you, but I don't want to stick the camera in my mouth. All right, and then next we have the supraglottic swallow technique, which facilitates closure of the airway entrance before and during the swallow, and also increases tongue-based motion and speed and extent of laryngeal elevation. And this involves first inhaling and holding your breath very tightly, bearing down. Keep holding your breath and bear down as you swallow. First you try with your spit, and then once you're comfortable with that, you move to a real bolus. You cough when you're finished with your swallow, and that hopefully will clear your airway as well. And the Mendelssohn maneuver, finally, increases the extent and duration of laryngeal elevation. Use of this maneuver in head and neck cancer patients has been shown to produce higher tongue base pressure amplitudes, longer pressure durations, and less pharyngeal residue. And this involves swallowing your saliva and paying attention to your neck as you swallow. You want to feel that something, whether it's your Adam's apple or your larynx, is elevating and lowers when you swallow. And then you want to make sure that you can hold it up a little bit just to practice your muscles. All right, I had to do those really quickly because there were 5 different exercises. You can look at the reference as well just to see where I got my pictures and everything. All right, thank you so much.